Hi everyone, Dr. Nemechek here. I want to go over something that comes up quite frequently. So you'll have children um, with autism, and as they are making gains and so forth, then parents are surprised, like suddenly they're given this new diagnosis of attention deficit disorder or attention deficit hyperactivity disorder. And the parents are like, where'd this come from? How did he get this problem? As if it's a separate problem. And I want to explain that this, how this happens. And these kids have had, you know, ADHD or ADD the entire time they've been autistic, and how this plays out. Now, it involves the ADD or ADHD involves the autonomic nervous system. This is the part of the brain that regulates blood pressure to the head. And there's studies showing that with ADD or ADHD, these patients have what's called low or cerebral hypoperfusion, low brain pressure. And we know that drugs like Adderall and Ritalin, they cause an increase in dopamine and specifically norepinephrine, and that boosts blood pressure to your head. Okay, and that helps. That's how the symptoms actually improve. Now, so low brain blood pressure, cerebral hypoperfusion. So what happens is you have these red blood cells that carry your oxygen. You breathe, you fill them up. You got to push them up at the right pressure for the oxygen to flow into your neurons, okay? If that's not right, you don't get adequate oxygen releasing to the neurons. They don't function properly. The brain kind of starts panicking and starts reacting and doing things that'll boost pressure. And again, this is due to damage or dysfunction of the autonomic nervous system. Now, if you have advanced autism, okay, what I'm talking about is kids that can't communicate well or at all, and they can't follow instructions yet, and so forth. These kids all have low blood pressure in their brain, all right, all of them, really bad, actually. And this low oxygen makes it hard for them to just be aware. It makes you confused. It makes you the brain will react by making you crave salt and sugar or liquids. It makes you hyperactive and toe walking that generates blood pressure. I didn't put it here. It makes the kids lay down flat to get rid of this gravity problem so they can get blood pressure in their head. It'll make them anxious. It makes them fearful. They can't sleep. And then when it gets really bad, you get a lot of aggression. These are all symptoms from low brain blood pressure. Okay, now you put the kid on the protocol, we lower inflammation, we start getting improvements, and the kids become more aware. They're starting to follow some commands, and they're able to actually sit, either with a therapist or in the classroom setting, and they still have low blood pressure. It's just not so bad. The behaviors have calmed down, but now the therapist or the teacher's looking, it's like, he's having trouble concentrating or remembering what he's reading here. And he can't sit very long. He must have ADHD. And so I don't blame them, but they're just describing the same low blood pressure problem that you had before. It's not a new thing that happened. Okay? Something didn't happen to give your child now a different problem. It's the same low blood pressure problem, just now being viewed in this other context, okay? So I just don't want you to think, oh, they got injured or some bad thing happened, because I've had parents say, oh, we tried the supplement and they gave them ADHD, and it really, it's not likely that happened. How do we fix this? As I just go over and over and over. Obsess about reducing inflammation. That is your primary treatment goal. The brain has these white blood cells called microglia that will prune the brain, repair the brain. If we can get the inflammation down, the brain can fix this, okay? And this allows for this autonomic nervous system to recover. The blood pressure regulation starts improving and like normalizing. And now, if it's bad enough that the child is having trouble functioning, the child maybe is having a lot of aggression or things like that, medications to boost blood pressure are appropriate while we're waiting for the brain to recover. Okay? Now, I mentioned like Adderall and Ritalin. I don't like those drugs because they tend to, the direct stimulation of the brain is just, the kids can't handle it. It's really difficult for them to handle it. I prefer Midodrine, Midodrine. Cardiologists know all about it. Some neurologists know about it. It's a drug we've used for a long time to kind of gently push blood pressure up. And that works great without causing other problems, okay? And then, people always say, well, how do we lower inflammation? Either of our starter packs have everything you need for the kids. And basically, it's a combination of balancing the intestinal tract with this prebiotic fiber called inulin, some omega-3s in fish oil. Omega-3s are molecules that turn off inflammation, and then a little bit of olive oil every day. And that blocks the inflammatory aspect of vegetable oils and other things that are in the food supply. That's it. It's pretty simple. These starter packs have everything you need. Shipping's free. We've got one. The yellow book is for autism. The blue book doesn't talk about autism, but it's more ADD, POTS, PANS, PANDAS, stuff like that. Both actually identical protocols, but some of the content's different. So I hope that helps clear that up for you. You parents, don't be surprised if you're given a diagnosis of ADHD. It's not things have gotten worse. They're actually functional now enough that people can make that diagnosis actually. And you just keep going with the protocol, and the blood pressure stuff always will normalize. It's one of the easier things to get fixed. It just takes a while, okay? All right, that's all for today. Everybody, take care of yourselves. Bye-bye.